Welcome back to Healthcare Insight on America's Web Radio. Now, I realized at the end of last session that I probably confused everybody about what the real title of these segments and these weeks of presentations around how to create a private healthcare system, what we even call ourselves. Well, I guess that's part of the startup issues of getting things straightened out. The actual name that we've given for these segments is Healthcare Insight, not Healthcare Insights with an S, but Healthcare Insight. Many times I'll say Healthcare Insights because I'm referring to the whole series of programs here, and I tend to use the plural for representing all of the Healthcare Insight segments. So if you're looking for anything in terms of the assignments, the homework, additional materials that I've talked about, you'd want to go for any of these segments to americaswebradio.com. If you want to read some additional information on the topics we're talking about, read ahead, understand what's going on in a little bit more detail, have a little bit more flavor and additional thoughts that can be presented to you. They are on www.healthcareinsight.net. So it's healthcareinsight.net without the S. So having cleaned up all that, let's move forward. Let's talk about some of the real details here of what Magna Health really is now that we've laid the foundation. Well, Magna Health guarantees coverage of pre-existing conditions. That's the number one issue that Americans are going to be voting on. If they believe the Democrats, as they've said over and over again, and they've been more protective and have a concept of Medicare for all that covers pre-existing conditions, or of single payer system where the government is going to cover everybody. They have a history and a background of going to Obamacare, which covers pre-existing conditions. So people will trust the Democrats on this issue. Republicans mouth those same words, but they haven't presented a model. They haven't presented an example of how they actually would cover pre-existing conditions. So they kind of use it as a bumper sticker, a slogan, but I don't think it's selling to the American people without some real substance behind it. That's what Magna Health does. It provides the substance, a real policy description that's easy for people to understand. And we're going to go into that ease of explaining it. If you're a politician, if you're an elected official, if you're a government employee that's trying to implement or develop healthcare insurance policies, you'll have a better understanding over the next few minutes. Well, Magna Health is a detailed health insurance reform plan that promises every American will have access to affordable, comprehensive major medical policies that will cover any and all pre-existing conditions. Now, Magna Health, while it provides for comprehensive major medical policies, people want choices. So it also has choices. There's no one single, one-size-fits-all concept under the Magna Health proposal. But if people need comprehensive major medical policies, if they want comprehensive major medical policies at an affordable price, Magna Health will provide for that. So the details and specifics we're going to be going over very shortly. We're going to start today as the final session of this week's program, and we're going to get into even more details. So if you're really into the details as a policy wonk or just as a really interested citizen, I'm going to try to explain it in very simple terms if you'll stay with us and come back next week for some of those. But let's get into the details we can while we have a few minutes remaining. So the overriding promise is that Magna Health will provide all Americans three options that guarantee quality, affordable health insurance. The first option is an application and acceptance by a participating insurer, whether you are an individual or you're a small group. And remember, while Magna Health can cover the whole spectrum of large and small groups, the real emphasis here is on individual and small group. So if you make an application to a participating insurer, and we're going to define participating insurers probably next week, we'll get into details of how and why insurers will want to voluntarily participate in this program. So first, you make an application and you'll get an acceptance. The second, if you are denied coverage by an insurer, but you're not truly uninsurable, we're going to set up a system where it can be reviewed. That rejection from an insurance company will be reviewed, and you'll get a certificate of guaranteed coverage. And you can go back to that insurance company that rejected you or to any participating insurers, and they will be required under this system to offer you insurance at an affordable price. So that's the second option. The third option is that you've been rejected after your application and you are truly uninsurable. You've had a heart attack, you've had brain injury, you've had any sort of debilitating issue that would make you uninsurable. Now, only about 2 or 3% of the population is truly uninsurable. So, but these people in the past have been shunted off into what used to be called high-risk pools. We kind of like, go away. We're going to give you high-cost, bad coverage premiums. High-cost premiums, bad coverage, and it's going to cost you a lot of money if you even want it. But we kind of want to get rid of those people in the past. This approach of Magna Health is the opposite. The people who are uninsurable have got diseases, accidents, impairments of one type or another, and they need the best support possible. They need the kind of support to stabilize their condition, hopefully to recover. But these are the people we need to be focused on. These are where some of the highest costs are. And as an example, a diabetic who is stabilized, who maintains their health, follows their doctor's orders, does the right things, is a whole lot less expensive than somebody who doesn't. You know, if you don't take care of yourself, you could go blind, you could have your foot impaired, you have all sorts of other conditions that will develop out of untreated diabetes. That's just one example. So we want people who need the most help to get the most help. They should have every service available that's out there for any large group, whether it's a Microsoft or an Intel or a General Motors. The people who have impaired health need the best care possible and access to the best doctors and treatment. That's it. That's the simple 1, 2, 3. Application, get acceptance. 2, get a certificate of guaranteed coverage if you're rejected, but you're not really uninsurable. And third, if you're uninsurable, you're going to participate in this impaired health support group. Simple, direct, and easily communicated. There are no gaps in coverage. If you're going from a group to an individual policy, health insurance policies are guaranteed to be issued to anyone wanting coverage. No one is required to buy insurance against their will, but 100% of Americans will be able to purchase affordable health insurance. And we're going to describe, as we get into the weeds, why it's going to be more affordable than we have today, why we're not reverting back to the pre-Obamacare underwriting system, and why we can really give and finance the impaired health support group. So if you want insurance, you will get a health insurance policy under one of these 3 options. I know it's hard to believe. It's easy to be skeptical. But let's continue on and discover how the details of Magna Health really works. Well, under Magna Health, empowering consumers will level that playing field and assure access to guaranteed coverage for everyone, to include coverage of any pre-existing condition. Again, they would be either directly accepting coverage by a participating insurer, provided a certificate of guaranteed coverage, or accepted into a subsidized impaired health support coverage. So here's how it works. You will make an application to an insurance company. And there's no standard for underwriting. Insurance companies have their own underwriting standards. Some reject lives that others would accept. So there's different levels of underwriting. Some want to be very strict, and some would call that in the past cherry picking, taking only the best lives. And others take on more lives. Blue Cross Blue Shield, an example, typically in the past, in their history, took on more lives than other insurance companies. That's not necessarily true today, but that's their history, just to show there's no industry standard for underwriting practices. So you submit an application. Well, this may shock some of you. But in the past, pre-Obamacare, under the underwriting that seemed to be so flawed, 88 to 89% of people who submitted insurance for insurance were accepted with acceptable coverage and acceptable premiums to both parties. So 88 to 89% are accepted under option number one. For those lives that are rejected, we're going to set up a new public-private entity that I call a health review authority. We need something to level that playing field, to create an equalized balance of the application and the acceptance process so that it's not all one-sided on the insurance company. So the health review authority, a public-private entity, will review any lives that are rejected. If they are not determined to be uninsurable, they will be given a certificate of guaranteed coverage. And about 9 to 10% of people who are rejected are in fact insurable, and they will get a guaranteed certificate of coverage. For the 2 or 3% that are truly uninsurable, they will go in to the impaired health support group. That group needs to be subsidized. They're typically high cost, but not necessarily, they're high risk, but not necessarily high cost if they're stabilized. But 2 or 3% of the population be put into an impaired health support group with all the services possible to help them get stabilized and hopefully, again, to be recovered from their condition. In this system, no individual or employer is mandated or required to purchase insurance. However, everyone has an option for affordable coverage. That first group covers 87 to 89% of the population. An individual or small group wanting fully insured health coverage can apply to any participating insurer, and they may secure mutually agreed upon coverage at discounted, standard, or experience rated or increased premiums. The second area, second option, about 9 to 10% of the population. If an individual or small group is insurable but is denied or unable to negotiate acceptable coverage at a fair premium, they can submit an appeal to the public-private mediator, this health review authority. If an insurance company's final offer is not considered reasonable by the health review authority, the individual or small group participant will be granted a certificate of guaranteed coverage. That certificate would include coverage for any and all pre-existing conditions. The third option, if an individual small group member is determined by the health review authority to be truly uninsurable, that individual would be provided coverage options that include a comprehensive major medical plan under a subsidized impaired health support group. So if we take our dollars, our tax dollars, and focus them on this group, it'll be far less expensive than Obamacare. Well, unfortunately, we're at the end of our time. So please come back next week and we will delve into exactly the questions that probably are coming from your mind as I describe these three options. The devil's always in the details, but in this case, it's not a devil. It's really a silver lining on how we create a public-private system. So join us again next week on America's Web Radio at the same time, Thursdays at 11 o'clock. And we'll just continue this journey together and find out how we create a private free market system. Thank you.